Hi there, welcome back to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and we're here with Dr. Chris Heitman and Dr. Ken Hamilton out of St. Clair Shores, Michigan.
Dr. Rodnick, nice to see you today.
Nice to see you.
Glad to have you guys back on the show. So last time we briefly talked about, and I want to get into it quite a bit more here, what I like to call the 3 phases of care that we see in a chiropractic office. The first phase of care we call initial intensive care or symptom relief care. And again, that's where most people first see us. They hear they have a bad back, they have a bad neck, they come to see a chiropractor, or they even hear that, you know, my kid has really bad ear infections or allergies or asthma. Maybe I'll bring them in. And so they start that phase of care. And their first, obviously, goal is to
get out of pain.
Get out of pain.
They want to feel better.
Relieve the symptom, right?
Absolutely.
And then we also have what we call corrective care. Corrective care is more like, I like to use the analogy of braces on your teeth, right? Couldn't go to an orthodontist and say, Doc, I have these crooked teeth, can you fix me tonight, right? That could take a long time.
Absolutely.
And so corrective care is on a more consistent basis, but it's to change some of the structure of the spine rather than just functional or feeling changes.
Yeah, and we know what a normal spine looks like. We've had a lot of experience in chiropractic with that, and it's important that we can take a patient's spine and look at the curves of that, and we can slowly transition that from an abnormal to a normal spine.
A normal spine.
Exactly, and that's how we should really base our adjustments.
Absolutely. And then the last phase of care is what?
We always talk about maintenance care, maintenance, or some people like to use the term wellness care also. And that's usually when patients like to come into the office. Maybe they're not experiencing any of the symptoms. Maybe they've already had their spine corrected in that sense, and they just want to feel good. They want to feel the best, and they want to be the best that they can be. Absolutely.
And I like to use the analogy with that. The same thing with the orthodontist. That's more like the retainer, right? You know, after braces come off of a set of teeth, if they don't wear a retainer, oftentimes over a long period of time, they may start to shift back.
Absolutely.
And it's the same thing with our spine. A lot of times after someone has had corrected spine, maybe it even looks near perfect. We leave it there, well, this person doesn't live in a bubble. They're doing the same things that they did to get their spine there in the first place.
Very true.
And so obviously over time, it may start to slowly go back. And so that's why maintenance or wellness care is very important. And usually the people that undergo maintenance or wellness care in our office, those are the people that really get it. They understand what we do. Those are usually not people that come by themselves. They usually bring in mom, dad, all the kids, the whole family comes in, grandma, grandpa. They understand it. They understand the power of having a healthy spine and a healthy nervous system.
Absolutely. These people tend to live their life to the fullest in that sense. They like to get out. They like to get out and play golf. They like to go for their runs. They like to play with their kids and have a good stuff like that. Everybody likes to do that, but I know the patients in our maintenance and our wellness category really do. They love to do anything that they want to do in their life. They have the power and the experience to do that.
We always emphasize how important the spine is to a human body. And so if you guys could explain why a spine is so important to a human.
Absolutely. Well, the spine, in a sense, literally is your backbone. It is literally the entire structure. Job number 1 of the spine actually has 2 functions. Job number 1 is protect you. It has to protect the vital organs of your brain, which we have here, which sits up on top. And then also the vertebrae themselves, they house the spinal cord. Arguably the 2 most important organs in the entire body, the brain and the spinal cord.
In fact, you know, people, obviously the heart's important, the liver's important, the lungs important. No organ aside from the central nervous system, the brain and the spinal cord, is completely protected and surrounded by solid bone. And so most people, when you ask what their spine's for, they think it's to hold you up, have some backbone.
Sure.
But its most important function isn't just to hold you up, it's protection from the vital organ, the vital nervous system there.
Protects us from damage, absolutely. And I know, as Dr. Ken always says, job number 2, it actually provides us with a highly unusual level of flexibility as human beings. And we're able to do a lot of the activities that we'd like to do. Right.
Obviously, the best protection may have been a solid tube of bone, but then the nerves couldn't come out. We couldn't bend, we couldn't twist, we couldn't do the things that we want to do on a daily basis. So that's why our spine is designed so amazingly to have these intervertebral frame or the holes where the nerves come out and go to control the rest of the organs.
And it really is the activities of daily living that can cause one of those bones to go out, get stuck, excuse me, and cause pinching and pressure on those nerves. And it is true, though you said, you want to have protection, but B, you want to have a highly unusual level of flexibility. So think about hanging up a picture on the wall. You're tip-tap, tippity-tap, tapping away with a hammer, and that hammer, which is supposed to be hitting the nail on the head, becomes that hammer which hits your thumb. Right tool, right task, wrong result. Can it happen? It happens all day. So can a bone go out of place, get stuck out of place, and put pinching and pressure on a nerve and then cause a whole cascade of events to occur? The answer is yes, it can. And that would look like the model where we have bright green flashing lights, go, let's be healthy. Bone goes out of place, causing pinching and pressure on the nerve. which would represent a lack of health. So the job of the chiropractor is to find that and put it back into place.
Let's
Right?
show that one more time, Doc. Let's show that a nice close-up on that on the camera.
Okay. So
If you can see the lights
the
here.
fast flashing would represent good or proper function. And when a bone goes out of place, it gets stuck out of place, it makes the hole through which the nerve passes, the intervertebral foramen, smaller, and that causes pinching pressure on the nerve, and that causes the nerve to be upset or not work as well. Therefore, the brain's not talking to the body, and the body's not talking to the brain. Now remember, anatomy tells us, research scientists tell us that you have about 29,000 miles worth of nerves in your body. In other words, please don't try this at home, Dr. Rodnick, but if you took all the nerves out of your body and touched them end to end to end to end to end, they would go all the way around the equator of the Earth at least once. New research shows us that the actual number is 67,500, so 2.5 times. The question that fascinates me now, after 29 years, 30 years in chiropractic, is why are the chiropractors the only people who are paying attention to such a huge nerve, to such a huge thing? It's massive in the human body, runs everything. So happy nerve, sad nerve, job of the chiropractor is to restore function. Let's make it happy.
Keep them happy.
Let's make it happy.
Let's talk about how important the nervous system is and what the nervous system's function in the body is.
Well, as we know, the nervous system, as we say earlier, it's the master system of the body. It actually coordinates and controls all other bodily symptoms. You mentioned the heart earlier, and we want to make sure that we can have that properly functioning nervous system, as I said, to control all other systems of the body. And as Dr. Ken showed on the model, if we have interference any way along that pathway when the brain talks to the body or when the body goes to talk back to the brain, if we have interference there, we have a lack of function. We have a lack of action in that sense, okay? And action, or in a sense, usually will manifest itself in the form of some symptoms. And that's usually what brings people into our office. Most often it's some back pain or some neck pain, but it can also be, we also treat patients in a sense for high blood pressure. That's a very common occurrence. I know in children, we often see a lot of difficulties with asthma in that sense too. So that's really the goal with that.
So we have this really amazing healing power and innate ability to heal within our body. The nervous system is the master control system which coordinates and controls this amazing healing power. For example, let's say right now somebody cut their finger. Of course, first thing that's going to happen is it's going to bleed. But over time, very quickly, that is going to clot. We're going to have a blood clot come. It's going to seal over that finger, seal over that clot. Now, how does the blood clot know where to go? Because what if that blood clot didn't make it to the finger, and instead it went to our heart? Now it's a myocardial infarction or a heart attack. Kills the patient. What if that blood clot didn't know where to go, and instead it went to our brain? Now it's an embolism or stroke. Kills you. Let's say it went to an artery in our legs. Now it's a thrombosis or a phlebitis. Kills you. How does it know exactly where to go? Because there's trillions of impulses constantly traveling and controlling every function of the body. I say to people all the time that we are self-healing and self-regulating organisms, meaning, in fact, we don't have to think about it right now for your lungs to breathe. You can be sleeping, your lungs are going to breathe no matter what. As long as you're alive, your lungs are going to do the best they can to breathe. You don't have to think about it for your pancreas to make insulin. You don't have to say, come on, pancreas, let's make some insulin right now. It does it automatically. Your kidneys are constantly filtering. Your spleen is always recycling old cells. These things are happening constantly and consistently all throughout the body. It's really amazing how it works. So we have about 70 trillion cells in the body that are constantly being replaced. And most people have heard that your skin cells die, you have new skin cells. Your heart cells die, you have new heart cells. 90 days from now, the heart cells are on a 90-day cycle. In about 90 days, we'll have almost an entirely new heart. Our stomach lining is actually replaced every 10 minutes. 10 minutes from now, we'll have an entirely new stomach lining. It's really amazing. So what happens if the signals are not quite right to where it's going to replace it? And now over time, we're replacing normal cells, and we're not replacing them with other normal cells. We're now replacing them with bad or dysfunctional cells. Now over time, that can cause all sorts of sicknesses, diseases, dysfunctions, tumors, you name it, because the body isn't being replaced healthy and normally.
Well, let's think about, excuse me, I had to take off. Let's think about Christopher Reeve. Superman falls off his horse, breaks his neck. Are we concerned about the fact that he broke his neck? Not as much as we are concerned about the fact that the razor-like edge of that broken vertebra cut the diaphragmatic nerve. So now his diaphragm isn't working. Well, should we look at it and say, well, he has muscle spasms? Well, no, he actually has muscle flaccidity. So is it a muscle problem? No, it's a neurological problem because the brain is now not talking to the diaphragm, and therefore the diaphragm's not performing its normal function. If they could have, and boy, they gave it all they had to try to make that happen, restore that normal communication, things would have been a little different. But you have to remember, in the typical person, they haven't cut the nerve all the way off. it's more like a dimmer switch or a rheostat on the wall. They've actually turned it down. So now you have a lack of communication between the brain and, let's say, the heart, and the person might have some high blood pressure. Or in the case of my daughter Sarah, when she was swimming and would get exercise-induced asthma, I would then adjust her, and then communication would come back, and she would clear out and go into the next heat.
And if you continue to look at the story of Christopher Reeve, not only was the diaphragm not working, you know, these are the nerves right up here near his atlas where it broke that control all the organs of the body. So immediately after his injury, he had to have a pacemaker keep his heart going, the artificial respirator for his lungs. He had to have insulin pumped into him. His pancreas couldn't make it. His kidneys were on dialysis. He had to be catheterized, couldn't go to the bathroom, because all the organs are controlled from that area and down. And that's why we say that that very top bone, the atlas, is not only the most important bone in the body, but certainly the most important bone of the entire spinal column, because everything goes right from there down. The brain stem is the only part of the brain that's not tucked deep up inside. If we can open this up here, most of the brain stem itself is tucked deep up inside here. Only a little tiny bit comes out, and that part goes through that very top bone. So that's one of the most important areas. It's the first one that I always check with our patients, that we make sure that the atlas is in its normal position and lined up. Because obviously not only is there a host of symptoms associated when it's not, but the body will just not be able to function at its optimum performance.
Absolutely.
Yeah, and I was talking to a patient just the other day, and we were talking about body chemistry, cholesterol, all that sort of stuff. And then we were talking about the body as an electrical machine. And I said to my patient, I said, well, think about the battery in your car. The battery in your car is a lead acid soup. And the lead acid soup emanates a spark that causes you, when you leave here after you've been adjusted, walk out to the parking lot, turn the key, it starts. Are you really concerned about the specific gravity of your battery or the stoichiometric chemistry between the lead and the acid? Or are you concerned about the fact that when you turn the key, it springs to life?
You're going to be moving.
And the patient said, well, I'm obviously concerned about the spark. I said, so think about your body the same way. We can't deny that cholesterol is important. We can't deny that your blood sugar is important. All those things are very important. But what do they exist for? They exist to produce that spark which emanates and manifests itself as you. The job of the chiropractor is to pay attention to that.
So as far as that goes, let's talk about performance. So we see the people with the symptoms, obviously, in our offices. But we also see people that want to increase overall performance. So we see athletes a lot of times that don't necessarily have symptoms, but they want to increase their total performance. And so obviously by keeping the spine in its normal alignment, we may get them to perform just a little bit better than they would have without it.
Absolutely. I know we talk about performance. Definitely the correlation between chiropractic care and athletes and success in those athletes is second to none. Several top athletes come to mind. Lance Armstrong, his chiropractor traveled with him and was actually one of the top medical advisors on his team while he won his 6 or 7 Tour de France titles. Michael Jordan, another frequent user of chiropractic, and even our own Detroit Lions, they have a chiropractic actually right on the sideline. They can actually adjust them right in the game, and that's definitely very common, especially in the NFL.
In fact, I think every single NFL team has a team chiropractor, but I think pretty much all across professional sports, I don't think there's hardly any teams now that don't have their own team professional chiropractor.
Absolutely, and as you said, just to increase performance on that, anytime if they have a muscle spasm or a muscle pull during the game, it's not that they're going to relieve that muscle spasm, it's that they're going to turn the nervous system back on to relieve that muscle spasm, and that's in a sense what makes the correction for it.
And that is absolutely the most important part of what we do for the athletes, but even just down to a musculoskeletal level, we can increase overall flexibility. I think of the case of a testimonial from a football kicker, and this kicker, he would get a couple lumbar vertebrae just twisted slightly to the side, and when that would happen, he wouldn't get the quite right rotation when he would kick. And so obviously, he would make sure he gets adjusted every time before he, goes to kick a field goal.
Absolutely, yeah. The psoas muscle itself actually connects. It's actually one of the only muscles in the body that connects to your low back, that actually connects to your hip, and then continues on down the leg. Connects right at that L3 bone. So that's perfect, absolutely.
We even see a lot of the athletes that do repetitive sports, obviously, like the golfing and tennis and bowling, things like that, because it's all one-sided.
Yes.
Right.
So because we see a lot of the one-sided things, we see a lot of subluxation and misalignments on that particular one side.
Yep. Absolutely, yeah. And we can definitely react, and we can definitely fix a lot of those problems also, without question.
Absolutely. So let's talk for just a few minutes about seniors. And I'm sure you guys see a lot of seniors in your office and want to talk about what you guys see with them, some of the conditions, and more importantly, how you can help with them.
Yeah, absolutely. I know the number one thing for me, we've actually been doing a lot of senior stretch classes, not only in our office here, but kind of all over the place. And the key with seniors is that, number one, you want to get them to stand up. I know that that's very, very important. A lot of them are kind of hunched over in a sense, and if they would just stand up and really use their body to the best of their ability, they're a lot better with that. They have a lot of success. We've been doing a lot of stretch classes with seniors also to keep them moving, keep them functioning. Oftentimes they're not working anymore, and they can kind of adapt that sedentary lifestyle, and that really tends to hurt them. It really definitely hinders them in a sense. So we really want to keep our senior citizens moving, number one. We want to get them to stand up, number two, and I think they have a lot more success that way.
Let's talk about that typical senior posture that you just mentioned. Typical senior posture, we get
Absolutely.
the hunch there.
Yeah.
And talk about how devastating that can be for overall performance of the body and overall health. You know, we start to see as people start to age, sometimes we get the little hunch.
Absolutely.
What is that doing to us?
Yeah. Well, I know that especially based on the structural anatomy of the spine, anytime we have that forward head motion, it places increased stress and pressure not only on the spine, but secondarily on your nervous system. And every time that head moves forward, it actually amplifies, in a sense, the weight of your head. We like to use an analogy of a bowling ball in the office, I know, when we talk to that about our patients. So anytime we have that forward head motion or that forward head posture, it definitely creates a negative effect and a negative impact on our spine and our nervous system. But as chiropractors, I know that everybody here, we're all trained to correct that. So that when they come into us in our office, we can fix a lot of those problems, and everybody responds much better to that.
One example I like to have our patients do all the time is to, and you can try this at home with me, take your head, push it as far forward as you can, and take a deep breath in. Now, in contrast, sit up nice and straight. Take a deep breath in. And obviously we can see we get much more air into the lungs.
Absolutely.
And up to 40% decrease in lung capacity, total lung volume happens when it's pushed forward like that. And we see with a lot of times seniors as they start to age, the spine actually gets stuck out of position like this, puts pressure now on the nervous system, and of course they're getting less lung capacity all the time. So they're not going to be able to not only breathe properly, but get the normal nerve function, normal nerve signal in there.
Yes. It's very important. So, and like I said, this is very important. We've even had some new exercises that we've been doing with our seniors. We've actually been doing some Straighten Up America exercises developed down at Life University in Marietta, Georgia, actually where I just graduated from. And we've had a lot of success with that. We're teaching people to stand up straight, and when they reach up for the ceiling like that, they actually have that increased lung volume, which is very, very cool.
And that's a program, Straighten Up America is an excellent program that I use these exercises also with children as normal spinal hygiene. Just like we said, you know, everybody should brush their teeth.
Yes.
Everybody should do something every day for their spine. So it's a simple program, a 2 to 3 minute exercise series, just like you brush your teeth for 2 to 3 minutes. That people can do every day to keep their spine healthy and not to form some of this early arthritis down the road.
Absolutely.
Dr. Chris and I, Dr. Chris was the lead on this, just gave a talk to 100 first graders, second graders? First graders.
First graders, yeah.
First graders at one of the local elementary schools, and we did all the Straighten Up America. We had them humming and butterflying, and it was a riot.
That is fun.
It was really cool. We
and
brought,
they really did good.
Yeah, we actually brought the giant spine with us, and we wheeled that in there. And they just went, whoa, like they had no idea what was going on. They're like, is that a dinosaur? And we're like, well, no, let us tell you what's going on. Yeah, so we went through a little bit about chiropractic and a little bit about, you know, about how a healthy spine should function and what they can do to be a little bit more healthy. We had a lot of fun with that with our kids.
I do a lot of that myself too, actually. In a lot of school systems, we do backpack safety.
There you go.
A lot of times
Absolutely.
kids are just destroying their spine by wearing half their weight on their back, hunching over, losing some of the curves, the lateral curves that we see in the spine, which can be devastating down the road. And let's talk about those curves a little bit here. If you want to go through one of these.
Absolutely, yeah. If we talk about just a regular spine here, we always look at spine not only from the front, but often people forget about what happens with the spine from the side. It's important that if we look at our spine from the side, we're supposed to actually have 3 or 4 curves in our back here. If we start with our head and our neck area, we're supposed to have a nice forward swooping curve here, kind of like a banana. It should be about 40 degrees. And as Dr. Adams said earlier, when we lose that curve, when that head moves forward, and we lose that curve, these holes here through which the nerve passed, they get smaller. And in a sense, what also happens, as I mentioned before, it really amplifies the head, and it actually adds more weight to our shoulders. It can really cause a lot of discomfort. The job of the chiropractor, when we make our chiropractic adjustment, is to actually restore that curve back to normal. This restores proper biomechanics, proper motion, and it really takes the pressure off the nervous system. As we move down through our spine, the curve in our mid-back is actually the opposite as our neck. We're supposed to have a nice backward curve in that situation there. Everything should move back, actually almost like a C in that situation there, and we should have the proper motion in that area. As we move down the spine, as we reach the low back, it should be the exact same curve as in our neck. Again, it should be about 40 degrees or somewhere in there. And again, we're supposed to have that nice forward swooping curve, almost like a banana. And again, if we lose that curve, these holes here through which the nerve passes, and it can really place a lot of discomfort on these discs. Often people, when they have a decrease in that curve, or maybe even too much curve, it places a lot of added pressure on those discs. And that can facilitate sometimes that degenerative or those arthritic processes. Okay, so it's very important that not only do we have our spine lined up from the front, but also that we can have our spine lined up from the side also. Very, very important.
Let's get back to the seniors and some of the other things that we see with seniors. With people with, let's say, better spines compared to worse spines. I notice a big difference myself, but you see seniors, we take an x-ray, and let's say their spine's not as bad. I notice, no question about it, those seem to be the people that have lived a much healthier life to that point. And we look at some seniors, they have a wrecked spine, and those are the ones that have maybe had some chronic problems for a long period of time. Is that something that you guys notice as well?
We have a patient, I'm hoping she's going to bring it in tomorrow actually. New patient, newer patient, and referred by some of our patients, been around for part of the chiropractic family at our office. And she came in last Friday and she said, Dr. Ken, do you know what I found out? No. She said, she is the benefits administrator for a big company. She goes, and since I came into your office, I thought I would look. She goes, so I actually looked, and I have found out, based on their company records, that the people of all ages, especially older people who are under regular chiropractic care, their utilization, their cost to the company for medications, any surgeries, any other kind of medical care is so low. She goes, I was shocked.
And that's including the expense for chiropractic care.
Including the expense for chiropractic care. She goes, Dr. Ken, I never saw anything like it. I'm going to print it out, black everything out, and I'm going to bring it in so you can see it. That's very
cool.
exciting.
I would love to see that.
Oh, yeah.
Absolutely.
It's happening right now.
That's really cool. And so we were going to talk a little bit also about compression fractures. And I know you had a testimonial to talk about with compression fracture. We have a model to show our studio audience.
Yes.
That's a type of a fracture in the spine that when people hear of broke their back or broke their neck, they think of first thing immediately paralyzing. This is the type of injury that's paralyzing. There are lots of different types of breaks in the spine. One specific is called a compression fracture. So we'll go over that in a second here.
A patient of ours, Cindy, was at work, was walking, didn't see someone's foot, tripped on her coworker's foot, went right straight down. It was a Tuesday afternoon. Dr. Lisa, my associate, was working, and she got up in a lot of pain. She came in the office and said, Dr. Lisa, it sounded just like a pop can crunching. Well, of course, Dr. Lisa, right away the red flags went up. She goes, I think we're going to take an x-ray. And they did, and they found that she had a compression fracture. Now, Cindy was already our patient, so we had the previous films to compare the new films to. So there it was black and white, no question, we could see it. So Dr. Lisa worked on the vertebra above, vertebra below, gave her some ice and heat instructions, stretching exercises for home, wrote her an off work slip. As the fates would twist, our gal Cindy had an appointment with her medical doctor the very next day for other issues, not related to this, and went in and walking very slowly, of course, and told him she had a compression fracture. Oh, there's no way you could possibly have a compression fracture. You wouldn't be walking. Well, I got a compression fracture. I went to my chiropractor. They adjusted me, and I actually feel a lot better. And so he recommended some things for her to do, which obviously, well, actually she didn't do. And we actually ordered up an MRI. And the CAT scan, sorry. And the CAT scan proved, with beyond a shadow of a doubt, that she had a full-blown compression fracture. That vertebra, instead of being this high, was now this high. She took it in to her medical doctor, and he saw it and went, wow, you really do have a compression fracture, and I can't believe you're still walking. She goes, well, I've been to the chiropractor twice a day, every day since, and that's why I'm walking. We now have her on, we're doing a cooperative experience with him. And between the two of us, we have her working. She's back to work half days, not full days.
That's amazing.
She can't make it through the whole day. In about 2 weeks, we got her back to half days. And
she's going to start. I know she's going to start aquatic aerobics too this week. We're going to try. We're at that point. We're going to start moving her into much more mobility and much more, much more action. We want to start really stabilizing that area. We've gone through some care with her. We're starting to retrain that musculature in that area to really hold that vertebra in place, and that's really the key. Anytime we have those fractures, a lot of instability can sometimes arise because of that. So we've been working with her with that, and I know that she was very excited to start some water aerobics this week. So we're very happy with that.
Yeah, it actually starts today.
Today, there you go.
That's amazing. And you see an injury like that many times. Like we see people that have had that for years, hadn't undergone treatment like this.
Yes.
And they already were a permanent disability, hadn't worked in years, and they come in like this in the first place, right? So it's amazing that she was already your patient before this happened.
Yeah. And speaking of our model here, if we take a look at it, you can see the compression fracture on the model right here. What happens is that as that bone, as it crunches down, it really does break the bone. It breaks the bony fibers in there, and it can cause a lot of stress and a lot of discomfort. And the number one thing that results from that compression fracture, besides some pain, is that if we take a look at this hole here through which that nerve passes, that hole gets smaller. So imagine a hole being this big through which the nerve to pass through. As we get that compression fracture, Dr. Ken said, that hole can get so much smaller and place even more pressure on our nerve. So it's very important that we can treat these particular fractures very safely and very effectively.
Let's talk for a second about symptoms being in the body for a reason. We talked briefly about this a minute ago, but I saw a recent study which was really amazing, something we've been talking about for years, and it showed that fevers increase the immune system, increase the production and the quality of our T cells, which are an amazing immune function cell that actually attacks foreign antigens. And it showed that the fever itself, anytime somebody had even a low-grade fever, helped increase the production and helped increase the quality and the function of those T cells.
Absolutely. And we know that even as chiropractors, the natural physiologic response of the body to any sort of infection or any sort of disease or something like that, oftentimes it'll create what's called a fever. It'll actually, the body will raise its own internal temperature, its own thermostat in a sense, naturally. And as a result, we get what's called the fever. And it's a very natural occurring thing in the body. And what happens as a result of that, it'll tend to speed up some bodily processes and it'll actually slow down some other processes. But by raising the internal temperature of the body in that sense, it'll actually help to denature some of the proteins that are in the body that maybe shouldn't be there, that are maybe there caused by bacteria in a sense. And when we have that fever, it actually works to increase the immune system, as you just said. We increase the natural killer cells in the body, we increase the T cells in the body also. And as a result, if we have that increased immune response, your body is much more likely to fight off an infection in that situation.
And that's something that a lot of people immediately, even they hear they have a low-grade fever, 99, 99.5, 100 degrees, they immediately want to get rid of the fever. Unfortunately, that's what the body's trying to do.
So, right. It's kind of the opposite mindset in a sense. It's what the body is trying to do itself and naturally to fight off the infection. So we have to get away from that mindset of trying to not do that. And definitely fever, once you reach a certain height, we have to be careful with that. I think maybe 104, 105
obviously
degrees.
Once it gets to that point, 104 degrees, then it's absolutely time for concern.
Yes,
make
absolutely.
sure we take care of it. But before that, it's helping our immune system. It's helping our body function.
Yes, you're talking low-grade fever, yes.
Yeah, low-grade fever, absolutely. And amongst other symptoms. So the body uses symptoms as its ability to try to do the right thing at the right time. We spoke earlier about muscle spasms and how they're a good thing as a self-splint for the body. Even things like vomiting, diarrhea, it's the body trying to reject and get rid of some toxins.
Do we have time for a story?
We have time for a short story here. We have just a couple minutes left here.
One of my great patients, been a patient for many, many years, her grandson came to a family reunion in August outside. He and his buddy showed up late. They had other parties to go to that day. He got there about 3 o'clock in the afternoon, and they were starving. So they ate hot dogs, hamburgers, and including the coleslaw, which had been out since 11. In the middle of all 200 people, my patient's grandson's buddy proceeds to get sick and vomits in front of everybody. What's wrong with him? I feel fine, the grandson said. That night at 11:30, he ended up in ICU for 3 weeks.
Wow.
So his buddy's immune system saw the invading organisms and expelled it. My patient's grandson didn't see it and got very sick.
Right.
Very sick.
It's amazing to see how that works. The body really is an intelligent organism.
Yeah.
So thank you guys so much for joining us today.
Thank you,
for
Dr.
having
Rodnick.
me.
We've had a great time here on Ask the Chiropractor. I'm Dr. Adam Rodnick out of Commerce Township. This has been Ask the Chiropractor, your source for ultimate health, healing, and chiropractic-related information. And remember that God gave you the gift of life, and what you do with that life is your gift back to God. We'll see you next time on Ask the Chiropractor.